My name is Dr. Salil Patkar. I'm a cancer specialist. Today I'm going to talk to you about cancer and the relation with tobacco. As most or some of you might be aware, 31st May is known as Anti-Tobacco Day. So I think it's very important that we take this as a landmark. We take this as a very important date in our lives and use it to improve our health. You see, the link between cancer and tobacco is undeniable. And in fact, in our country, in India, as per the latest data, nearly 65 to 70% of all cancers in our country can be directly linked with tobacco consumption. That's a remarkable figure. It's a remarkable figure. And probably leading among them is head and neck cancers and lung cancers. Did you know that in our country, nearly 70,000 people are being diagnosed with lung cancer every year? 70,000. 50,000 of them are probably males and 20,000 of them are females. That's a very high number of cancer patients for lung cancer. And nearly 80% of these patients, will have a history of tobacco consumption, either in the form of tambaku, gutka, chaini khaini, zarda, or in the form of bidis and cigars and cigarettes. And that's a large number of patients who can be prevented, who could be prevented from having cancer. You see, there is this wrong misconception that tobacco only causes cancers of the lung or the oral cavity. The truth is that tobacco contains more than 300 different substances which are designed to cause cancer. They are known as carcinogens. There are more than 300 different substances in that smoke or that cigarette that you have that causes cancer. And people think that it is nicotine that causes cancer, but that's not true. Nicotine has only one purpose. Nicotine is designed to cause addiction. It is nicotine that causes you to have that urge to have another cigarette. It is the nicotine that gives you that addiction. Can you imagine that you are having something in which they purposefully put a substance that will make it addictive, that will make you want to come back and spend more on that cigarette and more on that poisonous substance. And then there are 300 different substances which are just added to it, which are going to cause cancer. It's incredible. The thing is that it's very difficult to treat cancer. It's very difficult. It's very difficult for the patient to undergo the treatment, the surgery, the radiation, the chemos. It's very difficult not just for the patient physically, but even mentally. And it's not just the patient, it's even the relatives who have to go through that physical and that mental stress. And then there is the economic drain. Cancer is a social disease. It's definitely a family problem and it's a social burden. It's a social disease. The economic drain is tremendous on the family. And yes, cancer treatment has definitely improved. The cure rates are much better than what they were for maybe 10 years back. And today you have stage 4 lung cancer patients who can live for nearly 5 and 6 years if they have the right targeted therapies. But at the end of the day, I assure you that when it comes to cancer, treatment is always going to be second and prevention is always going to be first. Prevention is definitely better than cure when it comes to cancer. So I strongly urge you that instead of hoping that you ever have to come to visit me or any cancer specialist, I hope that you never have cancer. And the only way that you can guarantee that you bring down your chances of cancer is by quitting tobacco. There is no other drug in the world. There is no other anti-cancer pill. There is no magic treatment which can reduce your chances of cancer. The one thing that is definitely going to reduce your chances of cancer by nearly 60 to 65% is just giving up on tobacco. And I think that's incredible. A 60 to 65% reduction in the risk of cancer just by giving up tobacco. And that's a guarantee. That's a guarantee. That risk reduction is a guarantee. And I'm always asked that no, people don't have tobacco. Unko bhi to cancer hota hai. And that's true. बात तो सही है. अगर आप तंबाकू गुटखा कुछ भी नहीं करे तो भी कैंसर हो सकता है. But there is a relative risk. संभावना कितना चांस है कि कैंसर हो सकता है. The relative risk if you are a cancer smoker or a tobacco chewer is nearly 15 to 20 times higher. Not percentage, times. 15 to 20 times higher chance of developing lung cancer if you are a tobacco consumer or a cigarette smoker. And that's just lung cancer, okay? People have this wrong idea that tobacco only causes cancers of the oral cavity and the lung. But tobacco causes cancers of the tongue, the mouth, the oral cavity, the esophagus, the food pipe, the windpipe, which is known as the trachea, the lungs, the stomach, the colon, the prostate, the kidneys, the bladder. It's even been linked with blood cancer. So it literally is responsible for every possible cancer that you can think of, because it's not just the smoke that is harmful. It causes genetic, it causes mutations. It causes mutations in your DNA which predispose you to develop cancers. That's how harmful tobacco is. The carcinogens go and act at a molecular level on each and every cell in your body. Yeah, and then there is secondhand smoke. If you are a smoker, you are not only increasing your chances of cancer, you are also increasing the chances of cancer for all those around you. Now imagine if you have small children and you smoke in the house. These children are exposed to cancer causing smoke at such a small age. And if they go on to smoke at a later stage in their lives, they are already going to be destined to develop cancer at a much higher rate, at a much higher risk, because not only have they smokers, they also have been exposed to smoke at a very young age because their parents were smoking. Smoking is definitely the #1 killer when it comes to cancer. In the cancer story, #1 villain is smoking, it's tobacco, you know. And if you can give up on tobacco, you can bring down the chances of cancer incredibly. Like I said, 60 to 65%. And today it's much easier to give up on tobacco than what it was. It's not an easy journey to give up tobacco if you are addicted, of course. But it's possible. Today there are a large number of groups and NGOs which can help you. There are de-addiction centers which can help you. There are over-the-counter drugs such as nicotine patches and nicotine gums to help you in your transition from being a tobacco smoker or chewer to being one who does not do that. So these are things you really must consider. Take 31st May as a very important day in your life and make a plan that I will give up on tobacco. And it doesn't have to be, it's very difficult. You require family support if you're going to do that. But some of the basic steps you can take is go and meet your family, go and meet your brother, sister or parents and tell them, look, I want to stop smoking. Please help me and encourage me to do so. Tell your friends about it, that I want to quit smoking and please help me. If there's an environment in your house which promotes smoking, like you have a couple of ashtrays lying around, or you go to a particular room when you smoke, then don't do that. Get rid of all the ashtrays, get rid of all your all the cigarettes that you have lying around. That's #2 step. Create an environment. When you have the urge to smoke, try to get yourself, channelize that urge or energy into something else. Maybe listen to music, go for a jog, go for a swim. Of course, that might be difficult given the current scenarios, but direct your mind somewhere else. The most difficult part is towards the start. Your body needs time to adjust. It's been taking that smoke and that cancer causing substances and that poison for such a long time. It takes time. So the initial stage is always more difficult, but over a period of time, your body adapts and you get used to it. And take the help of friends and families. Take the help of any online, there are even apps which now help you to give up on tobacco. You can download certain apps from Play Store which help you to give up. They keep a track on your record on how well you are doing and help you to give up smoking. Make use of that technology. It is always most difficult towards the first couple of weeks. And if you can't give up immediately, cut down on your smoking. If you're having 2-3 packs a day, maybe cut down to half a pack a day. Over the next 1 month, try to cut down to maybe 3 or 4 cigarettes a day. Over the next 1.5 months, then cut down to less than 1 cigarette in maybe 2 days, and then eventually stop it. And if you at some point you go back to it, don't feel like a loser. Don't feel that, oh, I have given up, I'm such a loser. No, then restart. It happens. People take time to quit. Not everybody is able to do it in their first shot, but I have so many patients who have gone back and failed once, but they've tried again and they've succeeded. So don't give up. This is my only message to you. I hope that you never have to visit a cancer doctor. I hope you never have to visit a cancer hospital. I hope that you take this step and stop tobacco consumption and prevent your chances of developing cancer by nearly 60 to 65%. Not just lung cancer or oral cavity, but all cancers in general. Thank you so much. My name again is Dr. Salil Patkar. I'm a cancer specialist at Apollo Hospitals and at Oncura Cancer Clinics in Vashi and Navi Panvel. And my phone number is 845-1069-854. If you have any queries, please feel free to contact. Thank you.